So, Debs, you also asked about the work that we did during lockdown, during COVID, where we were allowed to prescribe for a period of time, roughly a year, where it was very difficult for owners to access care in veterinary practices, where they were only allowed to see emergency cases in person. And we did we produced a peer-reviewed paper that's been published in Veterinary Evidence, if anybody wants to have a look at it, which is a retrospective analysis of the cases that we saw that we'd given prescription medications to. I mean, the synopsis of it is, it was overwhelmingly showed that vets were able to treat cases remotely, effectively and safely using prescription medication. And a couple of other interesting points that came out of it is there was a far lower usage of prescription medications compared to what's reported in clinics. And in particular, there was very, very low use of antimicrobials, approximately 20% of the kind of number of consults ending up with an antimicrobial medication. And we thought that was really interesting because I think there's this fear that having remote care will lead to an increase in the use of antimicrobials. It certainly wasn't our experience in the 5,000 odd cases that had prescription medication that we saw during the lockdown. So if anybody wants to have a look at that paper, it is quite a detailed paper. You can have a look at that online.